Hello everyone and welcome to Medi Simplified. This is a short revision video for the toxicology. I've compiled all the topics which have been asked in INICET, FMGE and neetpg exam in one place. And in the upcoming 40-45 minutes, I'm going to explain you the whole toxicology, the whole important topics of toxicology, not whole toxicology, but the relevant topics which are being tested now and then in the upcoming exams, will be tested in the upcoming exams. So first we'll talk about toxicology. So toxicology is the study of poison, whereas toxinology is the study of living poison like snakes, scorpions, etc. Father of toxicology is Paracelsus, whereas father of modern toxicology is Matthew Joseph Orfila. Going further, we'll talk about the ideal poisons. दो टाइप के आइडियल पॉइजन पढ़ने हमें, एक तो होमिसाइड, सेकंड अपने पढ़ना है सुसाइडल पॉइजनिंग. होमिसाइडल पॉइजनिंग वो होंगे जैसे कि अगर हमें किसी का मर्डर करना है, if you want to murder someone, we'll use something which has no smell, no taste or no color. Right? It should have a small fatal dose and it should not be detected in lab. Also, it should mimic another disease. So, what is the most ideal homicidal poison? It is thallium, but it is very rarely used. Whereas most common used homicidal poison is arsenic and it mimics cholera. Cholera and arsenic, दोनों में हम देखते हैं rice water stools. Going for the ideal suicide poison. Ideal suicide poison is cyanide, whereas most commonly used is organophosphate, which is found in the pesticide. It's very sad that in India we see many cases of suicide by the farmers by using this pesticide. So it is most commonly used suicide poison, whereas the most ideal suicide poison will be cyanide. Now, what are the duties of a doctor in case of a poisoning case, right? So first duty is to start the treatment, and second, you should inform the police. Government doctor should inform all the cases of poisoning except attempt to suicide because it is decriminalized now, whereas the private doctor are bound to inform the homicidal cases. But if the attempt to suicide has been turned that the patient is died after attempting the suicide, then you should inform the police because there can be a case of homicidal, there can be suspicion of a homicidal. So government doctor should inform all the cases except attempted suicide because it has been decriminalized. But if the patient dies in the attempt of suicide, then you should inform the police. Private doctor, only homicidal cases you should inform. Now I have few tables. You can take the screenshot of these tables. Which will help you to clinch the diagnose. अगर कोई लंबा केस आ रहा है एग्जाम में और आपसे पूछ रहे हैं कि किस पॉइजन की वजह से हो रहा है, तो एक पॉइंट, हर लेंदी क्वेश्चन में कुछ पॉइंट्स होते हैं. कुछ क्या, जितने क्वेश्चन लेंदी होगा उतने आपको डायग्नोसिस के पास या आंसर के पास पहुंचने के लिए आपको हिंट मिल जाते हैं, राइट? तो बिटर टेस्ट होता है धतूरा का, बर्निंग टेस्ट है एसिड्स का, एक्यूरेट टेस्ट इज ऑफ कैलोट्रोपिस, स्वीट टेस्ट होता है एक्ोनाइट का, इसलिए एक्ोनाइट को मीठा जहर कहते हैं. सोर टेस्ट इज ऑफ ऑक्सैलिक एसिड, मेटालिक टेस्ट होता है कॉपर और आयोडीन का, स्वीट बर्निंग टेस्ट होता है कार्बोलिक एसिड का. इट वाज आस्क्ड इन 2019, राइट? FMGE एग्जाम. कॉस्टिक सोडा लाइक टेस्ट होता है अल्कलीज का. अनदर टेबल डायग्नोस्टिक ऑर्डर का, जो टॉपिक्स which the points which I have ticked here, I took a class recently, so there I taught this. So जो भी चीजें टिक की हुई है that are more important out of this rapid revision also, right? So garlicky taste is of arsenic, OP and thallium. Bitter taste is of bitter almond taste is of cyanide and prussic acid. Burnt rope, if you burn a rope, मोटा वाली जो रस्सी होती है ना, अगर उसको जलाओगे तो जैसा उसमें स्मेल आता है, सेम स्मेल दिखता है कैनबिस में. जैसे कि अगर आपको क्वेश्चन आएगा गांजे का स्मेल क्या होता है, इट इज बर्न्ट रोप स्मेल. फिशी स्मेल इज ऑफ जिंक फॉस्फोरस. रोटन एग लाइक स्मेल इज ऑफ H2S, दैट इज हाइड्रोजन सल्फाइड एंड डाइसल्फ्यूरान. शू पॉलिश लाइक टेस्ट होता है नाइट्रोबेंजीन का. एसीटोन की तरह स्मेल होता है क्लोरोफॉर्म, इथेनॉल और आइसोप्रोपेनॉल का. एक्रिड मतलब पियर जो फ्रूट है उसके जैसा स्मेल होता है क्लोरल हाइड्रेट का. विंटर ग्रीन है मिथाइल सैलिसिलेट्स का. मॉथ बॉल्स, कैम्फर या नैफ्थलीन बॉल जो होते हैं उनका स्मेल जैसा आता है, वैसे कैम्फर और नैफ्थलीन में स्मेल आता है. हॉस्पिटल में जो एक टिपिकल स्मेल आता है वैसा स्मेल आएगा अगर कार्बोलिक एसिड का पॉइजनिंग है तो. कैरेट और मस्टी स्मेल इज ऑफ हेमलॉक एंड सीवर गैस लाइक स्मेल इज ऑफ H2S एंड केरोसिन का जैसे स्मेल होता है ओपीज का. तो केरोसिन ऑर्गेनोफॉस्फेट, अब देख लो आप यहाँ पे कि इट इज ऑल्सो हैविंग केरोसिन लाइक स्मेल एंड गार्लिक स्मेल. तो केरोसिन इज मोर अप्रोप्रिएट देन गार्लिकी. So if organophosphate ka smell is will be given, it will be kerosene like smell. If it is garlicky, then also it can be a OP poisoning, but more appropriate answer is kerosene. Now, color of mucous membrane of stomach, right? So when we do the postmortem, we see a typical color of the mucous membrane. So these are the important, once again an important table. Starting में मैंने table दिया है. Later we have whole topic in discussion. So first you should write this table or take a screenshot, whatever, so that you can clinch the diagnose if there is a lengthy question in the exam, right? So blue color होता है म्यूकस मेम्ब्रेन का ऑफ स्टमक इन एमाइटल पॉइजनिंग, राइट. ग्रीन होता है फेरस सल्फेट, पिंक इज ऑफ सोनेरिल, स्लेट लाइक mucous membrane will be seen in mercury poisoning, black in sulfuric acid and acetic acid, gray will be in hydrochloric or oxalic acid, yellow or dark brown will be in nitric acid, puff white or grayish white will be seen in carbolic acid poisoning, gray white will be seen in caustic and alkalis, blue green mucus will be seen in copper poisoning, yellow will be seen in phosphorus poisoning, brown will be seen in iodine poisoning, and blue green will be seen in copper poisoning. So this will be the autopsy finding of the mucous membrane. If there is this color is there, so it is this poisoning. So it will help you to once again diagnose. This is a very complex table. First of all, I'll tell you to not look at this rifampicin mnemonic. It is just to, when I was teaching, I just to explain one thing out of the box. I went to tell them about rifampicin. Here, important thing is the PCT necrosis causing poisons are lysol, phenol, mercury, and cadmium. This four you should remember. Then poisons imparting color to urine. Due to some poisoning, there will be color change in the urine. So the middle line is important for the exams. Green color urine will be seen in phenol and cresol poisoning. Orange coloration will be seen in rifampicin poisoning, phenothiazine poisoning, and santonin poisoning. Rifampicin makes secretion orange, right? So orange urine, orange sweat, ऐसे सारी चीजें दिखती है. Rifampicin, excess of rifampicin, rifampicin toxicity. Yellow color of poison will be seen in dinitrophenol or arsenic poisoning. Pink will be seen in aniline or mercury. Purple color of urine will be seen in porphyrins. Brown color will be seen in nitric acid poisoning. Black to brown or brown to black will be seen in thymol or naphthalene. Blue color urine will be seen in methylene blue poisoning or toxicity. Red color will be seen in phenolphthalein or mephanism poisoning. Poisoning producing albuminuria are arsenic, mercury, chromate, phenol, and thallium. So this were the four important table. I want you to take screenshot or to remember anyhow, so that if there is a lengthy question given in exam, you can crack it, right, and get to the diagnosis. Now talking about last table, that is effect on the pupil. Some poisons do the mydriasis, matlab dilatation of pupil. Some poison will do meiosis, that is छोटा हो जाएगा, constriction of the pupil, right? So कौन-कौन से poison meiosis कराते हैं? Barbiturates, phenodiazepines, carbamates, caffeine, carbolic acid, nicotine, opiates, and opium. ये सारे meiosis कराएंगे, मतलब the pupil will constriction of pupil. Whereas mydriasis is seen in alcohol poisoning, amphetamines poisoning, antihistamines poisoning, cocaine, Dhatura, ephedrine, carbon monoxide, and cyanide poisoning. Now there will be few history of fixation of pupil, मतलब pupil dilate होते-होते रुक गया, ठीक है? So that is seen in anesthetic agents, respirin, and Rauwolfia alkaloids. Whereas nystagmus is seen in alcohol, barbiturates, carbamazepine, phencyclidine, and phenytoin poisoning. So once again, this was an important table. So 4-5 important tables. Now we'll talk about the Drug and Cosmetic Acts. Specific question आता है, ठीक है? सबसे important चीज, the Drug and Cosmetic Act of 1945. It has given some schedule of drugs, right? So Schedule C is for all biological product, E is for poisons, Schedule F is for vaccine, Schedule G is for hormones. ऐसे सारे drugs को schedule लिखा गया है, right? So important is to remember Schedule X. Schedule X is drugs with potential abuse. ऐसे drugs जिनका abuse हो सकता है, that is Schedule X. When there is another thing that is Category X. Category X is different. Category is different. Schedule is different. So Category X is contraindicated in pregnancy, drugs which is contraindicated in pregnancy, whereas Schedule X is those drugs which are having potential abuse. So just remember this thing, that don't make a mistake over here, that Schedule X is for drugs with potential abuse, whereas Category X drugs are contraindicated in pregnancy. Okay, let's go further. We'll talk about corrosive poisonings, right? So in corrosive, first we'll talk about H2SO4, that is sulfuric acid. So in this, I have not went into the detail of the poisoning. I have mentioned the important points which are being repeatedly given in the history of exams, or even if you give the grand test or practice MCQ, you will find this thing in the questions. So that the main purpose, अपना main goal क्या है कि question solve होना चाहिए. इसलिए मैंने सबको एकदम short रखने की कोशिश की है. ठीक है? So sulfuric acid, it is used in vitriolage, so also known as oil of vitriolage, मतलब acid attacks. All teeth, all tissue in contact will become black except teeth. Teeth will turn into chalky white. So sulfuric acid जब भी use करेगा कोई, तो जैसे vitriolage में use किया, तो जो भी टिश्यू कॉन्टैक्ट में आएगा वो ब्लैक कलर का हो जाएगा सल्फ्यूरिक एसिड पॉइजनिंग में, एक्सेप्ट द टीथ विल टर्न चॉकी व्हाइट। गैस्ट्रिक परफोरेशन इज मोस्ट कॉमन विद H2SO4। जितने भी एसिड्स हैं जो गैस्ट्रिक परफोरेशन करा सकते हैं उनमें मोस्ट कॉमनली H2SO4। वेट ब्लॉटिंग पेपर अपीयरेंस ऑफ स्टमक। ट्रीटमेंट में हम वी यूज मैग्नीशियम ऑक्साइड विच इज द बेस्ट एंटीडोट फॉर सल्फ्यूरिक एसिड पॉइजनिंग, राइट। नेक्स्ट विल टॉक अबाउट नाइट्रिक एसिड। नाइट्रिक एसिड is also known as aqua fortis, tezab in Hindi, right? So all the tissue contacts will turn yellow due to tyrosine. ठीक है, this is called as xanthoprotic reaction. This will learn in biochemistry. So all tissue in contact will turn yellow. Sulfuric acid में क्या हो रहा था? All tissue is turning black. Nitric acid में all tissues are turning yellow and urine color will be brown, which we already saw on that table. One more thing is that boric acid. Boric acid बोरिक पाउडर पता होगा आपको, कैरम के उस पे यूज करते हैं। तो बोरिक एसिड की पॉइजनिंग से एक सिंड्रोम होता है जिसको बॉइल्ड लॉबस्टर सिंड्रोम कहते हैं। ये एक बार क्वेश्चन आया तो इसको आपको याद रखना है। नेक्स्ट विल टॉक अबाउट ऑक्सैलिक एसिड। ऑक्सैलिक एसिड इज आल्सो नोन एज शुगर एसिड और एसिड ऑफ सोरेल। लोकली इट विल ब्लीच द म्यूकोसा। ठीक है, ब्लीचिंग पाउडर डालने पे जैसे अपना हाथ का या किसी भी सरफेस का कलर हो जाता है वैसा ब्लीचिंग ऑफ म्यूकोसा हो जाएगा। Systemically, it will damage the kidney, so renal damage and decrease calcium. तो उल्टी होगी अगर ऑक्सैलिक एसिड का पॉइजनिंग हो रहा है तो उल्टी होती है, उसको कहते हैं कॉफी ग्राउंड वोमिटस। फॉर ट्रीटमेंट वी यूज 10 ml 10% कैल्शियम ग्लूकोनेट। ऑक्सैलिक एसिड में डिक्रीज इन कैल्शियम हो रहा है तो वी यूज 10% 10 ml ऑफ कैल्शियम ग्लूकोनेट। MLI, that is medico legal importance. Oxalic acid is used as a ink removing solution used for illegal overwriting. जैसे आप कहीं पे किसी डॉक्यूमेंट पे you suspect that in some document you suspect that there has been overwriting done, so there you can use to remove the ink the oxalic acid. So it is having a medical legal importance. It is used as an ink removing solution used in illegal overwriting. So oxalic acid, also known as acid of sugar, acid of sorrel, it is locally it will bleach the mucosa. Sulfuric acid it will turning black. Oxalic acid it is turning the bleach, it is showing bleaching of mucosa. In nitric acid we saw yellow color discoloration. For treatment, we are using 10% 10 ml calcium gluconate. Now, next we are talking about carbolic acid. We are done with sulfuric acid, nitric acid, oxalic acid. Last is carbolic acid, जिसको हम normally phenol कहते हैं. ठीक है? So it is only acid which is causing meiosis. Meiosis was constriction. All the acids are causing dilatation. That is mydriasis. But the carbolic acid is the only acid which is causing meiosis. Next thing, it is used as antiseptic and it causes PCT necrosis. Lysol, phenol, all those are causing PCT necrosis. And it will delay the decomposition of the body. Metabolites, it has two metabolites. Phenol is having two metabolites. One is pyrocatechol and second is hydroquinone. Hydroquinone is responsible for the poisoning, whereas HNP, if it is excreted through urine, it will show green color urine. It is called as carboluria. Carbolic acid, it is the only acid which is causing meiosis. It is causing PCT necrosis, and it has two metabolites: pyrocatechol, that is P, and hydroquinone, that is H. So, out of these two, which is the metabolite which is responsible for the poisoning? It is hydroquinone, right? So remember this thing. And if this HNP, that is pyrocatechol and hydroquinone, is getting excreted through urine, so it will give a green color discoloration of the urine, and this is known as carboluria. Now, phenol marasmus. There is one term called as phenol marasmus. It is seen in chronic phenol poisoning if HNP, that is hydroxyquinone and pyrocatechol, it gets deposited in the skin or cartilages. It will do the yellowish pigmentation, and this is known as ochronosis. Okay, so ochronosis. So phenol poisoning में, if there is a chronic phenol poisoning, बहुत दिन एक ढक्कन कोई पी रहा है ना, तो उसमें क्या हो रहा है? HNP जो हाइड्रोक्सीक्विनोन है वो और पायरोकेटोकॉल वो स्किन और कार्टिलेज पे जाके डिपोजिट हो जाएंगे. जब स्किन और कार्टिलेज पे डिपोजिट हो जाएंगे तो उसमें येलोइश पिगमेंटेशन होगा, मतलब कार्टिलेज और स्किन येलो कलर का हो जाएगा. उसको हम ओक्रोनोसिस कहते हैं. इन ऑल एसिड पॉइजनिंग गैस्ट्रिक लवाज इज कॉन्ट्राइंडिकेटेड. ठीक है, अब हमने अभी तक जितना भी देखा MgO यूज कर लिया हमने, ठीक है, ट्रीटमेंट के लिए 10% 10 mg ऑफ कैल्शियम ग्लूकोनेट यूज किया हमने, और हमने कहीं भी गैस्ट्रिक लवाज नहीं किया. इन ऑल एसिडिक पॉइजनिंग गैस्ट्रिक लवाज इज कॉन्ट्राइंडिकेटेड एक्सेप्ट फिनॉल. ठीक है, अब फिनॉल में हम क्यों कर रहे हैं गैस्ट्रिक लवाज क्यों कर सकते हैं? बाकी सारों में देखा होगा आपने सल्फ्यूरिक एसिड में वेट ब्लॉटिंग पेपर जैसा हो जा रहा था, मतलब वो बहुत इजीली अगर ट्यूब डाल रहे हैं स्टमक में, इट कैन इजीली परफोरेट एंड कॉज पेरिटोनाइटिस. बट in case of phenol, it is making the it is making the gastric mucosa as a leathery stomach, right? So it is causing leathery mucosa, leathery stomach mucosa. That's why we can do gastric lavage in phenol poisoning, but not in other acid poisoning. Okay, there is a one stage of gastric cancer. It is a question I want you guys to comment down the answer. There is a one stage we study in surgery where we see linitis plastica, right? So there what happens, I want someone to comment down there. This way you can integrate the topics. Here it is done using vegetable oil and olive oil. Usually we do using different thing for gastric lavage, but in case of phenol poisoning, where it is not contraindicated unless it is another acid poisoning. So here it is done using vegetable oil and most commonly olive oil. So this was about acidic poisoning. Now we'll talk about one poisoning that is a non-metal poison, that is phosphorus poisoning. So phosphorus is two types. One is white phosphorus, another one is red phosphorus. So red phosphorus is non-toxic. It has no typical smell. मतलब जितना भी अभी तक हमने phosphorus का smell देखा, garlicky smell था, या उसका कुछ fatal dose होगा. So everything that is about the toxic one, that is white phosphorus, right? But the red phosphorus is having no smell. It is non-toxic. It is having no morphology. It is non-luminous, and it is where we see it on the side of the matchbox. अगर किसके पास matches हो भी, तो matches के side में जो है जिसपे हम matchstick को rub करते हैं, तो उस पे red phosphorus होता है. Whereas white phosphorus is garlicky in smell. It is having a fatal dose of 60 to 120 mg. It is crystalline. It is luminous. It is used in Diwali poisons, right? It is called as Diwali poison. It is used in crackers. Now, once there was a question that matchstick contains what, right? Matchstick contains potassium chloride and antimony sulfide. Never mark that matchstick contains the. Never mark that the matchstick contains the red phosphorus. The side of the matchbox will contain the red phosphorus, whereas the matchstick will contain the potassium chloride and antimony sulfate. I brought my matchstick from the mandir. Okay, so this side, the side जो है इसका, it is having red phosphorus, whereas this matchstick, अगर दिख रहा हो तो इसका जो ऊपर का red ये part है, it contains potassium chloride and antimony sulfate. Okay, I hope this is a bit clear now. So let's go further. So now let's talk about the phosphorus poisoning a bit of detail. There will be always given a history of a smoky stool. ठीक है, जो धुआं उठता है वैसा stool दिखेगा. So phosphorus poisoning way we'll see smoky stool. It is also known as hemorrhagic syndrome. The poisoning can also called as hemorrhagic syndrome because in that we'll see hematemesis, मतलब खून की उल्टी. Hematuria means blood in the urine, and purpuric spot, मतलब body पे red spots आ जाएंगे. So it is seen in phosphorus poisoning, that is hemorrhagic syndrome. In acute poisoning of phosphorus, we see atrophy of liver. In chronic poisoning of phosphorus, we see phossy jaw, chronic osteonecrosis of mandible. ठीक है, तो mandible bone जो है इसके angle पे osteonecrosis हो जाता है. So that is also seen in phosphorus poisoning. Antidote is copper sulfate, never used orally. It can act as a poison, right? So this is important thing to remember about phosphorus poisoning. Now we'll talk about OP poisoning. OP, organophosphate, it inhibits cholinesterase. Acetyl-CoA and plasma cholinesterase. So acetyl-CoA is the most specific indicator for OP poisoning, and pseudocholinesterase is the most sensitive indicator for OP poisoning. These two things you should remember: acetyl-CoA and plasma cholinesterase. Acetyl-CoA is the most specific indicator for OP poisoning, and most sensitive is plasma cholinesterase. Now, what are the clinical features of OP poisoning? First is muscarinic function, and then will be nicotinic function. आपने फार्मा में पढ़ा होगा, एक M receptor होता है, N receptor होता है. So muscarinic function क्या क्या होंगे उसके? Salivation, बहुत सारा saliva निकलेगा. Lacrimation, आंसू आएंगे. Excessive urination, GI distress, emesis, उल्टी आएंगी. Meiosis मतलब pinpoint, और OP poisoning में pinpoint meiosis होता है. Next is nicotinic effects, muscle weakness होगा, areflexia, tachycardia, cramps, hypertension, and chromolacruria, मतलब red tear. It is due to abnormal porphyrin metabolism. So these are the clinical features: few muscarinic and few nicotinic. Muscarinic में excessive salivation, excessive lacrimation, excessive urination, GI distress, emesis, and pinpoint meiosis. Whereas nicotinic effect में muscle weakness, areflexia, tachycardia, cramp, or hypertension. One more important thing is red tear, which is seen due to abnormal porphyrin metabolism in OP poisoning. It is also called as क्रोमोलैक्रोरिया। ट्रीटमेंट में we use atropine and oximes. Post-mortem finding of OP poisoning, we see kerosene-like smell of gastric content. Plant penicillin, endrin. Carbamate poisoning, only use atropine. Okay. So there is one more thing called as endrin, which is plant penicillin. If there is a carbamate poisoning, we use only atropine. Oximes are contraindicated. दो चीज होता है ना, जैसे अभी atropine and oximes we used in atropines and oximes we used in OP poisoning. But if there is a case of carbamate poisoning, typically given carbamate की poisoning हुई है, then we use only atropine. There oximes are contraindicated. Now there one more thing is pyrethroids, जिसमें we treat the symptoms. We never use atropine nor we use oximes. So both are contraindicated. So once again, OP poisoning के treatment में we use atropine and oximes. Carbamate poisoning में we use only atropine. Oximes are contraindicated. One more thing is there, which is called as pyrethroids. उसमें treatment is symptomatic. And we do not use atropine nor we use oximes because both of them are contraindicated. Now we'll talk about the heavy metal poisons. First is arsenic, then we'll talk about mercury and lead one by one. So arsenic poisoning, arsenic mimics cholera, right? We see water stool, rice water stool, sorry, one second, rice water stool. Okay, next, what is seen in chronic arsenic poisoning? First is hyperkeratosis, palms में or sole में. I'll show you the image soon. So in palm and sole, there is a hyperkeratosis. Raindrop pigmentation is also seen. मतलब हाथ में ऐसा लगेगा कि पानी के धब्बे हैं, मतलब पानी गिरा हुआ है. अगर जमीन पे कभी आप देखो मिट्टी पे अगर थोड़े बूंद गिरे हैं पानी के, बारिश के, तो जो अपीयरेंस होता है वैसे हाथ पे दिखता है. तो इट इज कॉल्ड एज रेनड्रॉप पिगमेंटेशन. इट इज अ डिफरेंशियल डायग्नोसिस फॉर मीजल्स एंड सेकेंडरी सिफिलिस. उन दोनों डिजीज में भी ये चीज दिख सकती है. नेक्स्ट इज एल्ड्रिच मीस लाइन. जो फिंगर होता है उस पे व्हाइट लाइंस आ जाते हैं, उसको कहते हैं एल्ड्रिच मीस लाइन, व्हिच इज आल्सो सीन इन आर्सेनिक पॉइजनिंग. पेरिफेरल न्यूरोपैथी हो जाती है. सबसे पहले सेंसरी लॉस होगा, उसके बाद मोटर लॉस होगा. सो पेरिफेरल न्यूरोपैथी भी दिखती है. सो क्रोनिक आर्सेनिक पॉइजनिंग, फर्स्ट इज हाइपरकेराटोसिस, हाथ और पाम एंड सोल में. सेकंड इज रेन ड्रॉप पिगमेंटेशन. थर्ड इज एल्ड्रिच मीस लाइन एंड पेरिफेरल न्यूरोपैथी. फर्स्ट सेंसरी विल गो, देन मोटर. So this was about arsenic. So these are two images. This is hyperkeratosis, if you can see it. Okay, and this is raindrop pigmentation. Okay, so now go further. Test to detect arsenic poisoning. Arsenic poisoning को detect करने के लिए हम कुछ टेस्ट यूज करते हैं. एक है मार्श टेस्ट, दूसरा है रीनिश टेस्ट. But best is spectroscopy. For treatment of arsenic poisoning, we use BAL, that is British anti-leucide. Suxymer DMSA जो है, it is a better answer. पहले it is a recent update. First we should mark. First we used to mark the BAL as the correct answer. Now we should mark DMSA, that is DMSA, Suxymer, which is the recent update. So mark this. If there is an option to treat arsenic poisoning, which is the best? If there is a BAL and DMSA both, so mark DMSA. If there is no DMSA in the option, go with BAL. Then post-mortem finding, we see red velvety stomach in arsenic poisoning, and also we see subendocardial hemorrhage. It is also seen in phosphorus and mercury poisoning. Now mercury में in acute poisoning we see 3G, glossitis, gingivitis and grey white tongue. In acute mercury poisoning we see 3G, gingivitis, glossitis and grey white tongue. Glossitis means tongue swell हो जाएगा, gingivitis means gum swell हो जाएगा, ठीक है, इन्फ्लेमेशन होगा, और जो टंग है इट विल बी ग्रे एंड व्हाइट, ग्रे टू व्हाइट इन कलर. सो दिस इज सीन इन acute mercury poisoning. Chronic mercury poisoning is also known as hydrargism. तो उसमें क्या क्या दिखेगा? फर्स्ट इज ट्रेमर्स. उस ट्रेमर को वी कॉल एज Danbury tremors. It is first seen in finger, then it spreads in the whole body. So it is called as Danbury tremors, which is seen in chronic poisoning of mercury. Progressive tremors होते हैं, इसलिए उसको बोलते हैं ग्लास ब्लोअर्स और हैटर शेक. Concussio mercurialis, unable to do any work. Acrodynia मतलब पिंक पफी रैशेस हो जाते हैं पूरे बॉडी पे डिफ्यूज, इसलिए क्रोनिक मर्क्यूरी पॉइजनिंग को पिंक डिजीज भी कहते हैं. मर्क्यूरिया लेंटिस, एंटीरियर लेंस कैप्सूल में मर्क्यूरी का डिपोजिशन हो जाता है जिसको मर्क्यूरिया लेंटिस कहते हैं. मिनामाटा डिजीज, ऑर्गेनिक मर्क्यूरी पॉइजनिंग बाय फिश. जापान में एक सिटी है जिसको कहते हैं मिनामाटा. वहां पे एक हिस्ट्री है कि फिश में पॉइजनिंग हुई थी मर्क्यूरी की, और वो लोगों ने खा के बहुत सारे बच्चों की हालत खराब हुई थी, बहुत सारे डिजीज हुए थे, इसलिए इसको मर्क्यूरी को मिनामाटा डिजीज भी कहते हैं. तो this is pink puffy rashes, right? Pink discoloration and pain. This is called as acrodynia or pink disease. And this is Minamata disease का एक image है जिसमें patient will have ataxia and impairment of speech and hearing. Now we'll talk about lead poisoning. Lead poisoning is also known as chronic lead poisoning is also known as plumbism or saturnism. Earliest manifestation circumoral facial pallor. Oral के मतलब माउथ के सर्कल में यहाँ पे facial pallor मतलब discoloration होगा. In blood we'll see microcytic hypochromic anemia. This will learn in pathology. So ये lead poisoning में microcytic hypochromic anemia होगा. We can also see eosinophilia and basophilic stippling in RBC. Blue Burtonian line is seen in the teeth and gum junction. जहाँ पे teeth है और gum है उनका जो junction है वहाँ पे bluish discoloration होता है या blue color का एक line दिखता है जिसको blue Burtonian line कहते हैं, which is also seen in lead poisoning. All these images are not there in this short revision. When the exams will come near, I'll try to upload all the images of FMT together, not just toxicology, but all the images. As one such images video is there on our channel for ophthalmology. The link will come somewhat here. You can get it and watch it if you want to revise the images of ophthalmology. So blue Burtonian line is seen at teeth and gum junction. Blue Burtonian line is seen at the teeth and gum junction. Lead palsy, मतलब lead palsy में क्या होता है? Extensive group of muscle will paralyze and we'll see wrist drop and foot drop. So wrist drop is, if you learn what we learn in ortho and anat, that is wrist drop is due to radial nerve injury and foot drop is due to common peroneal nerve injury, CPN. So lead palsy में भी extensive group of muscle will paralyze and we'll see wrist drop and foot drop. Dry belly ache, painter's colic and Devon's colic. मतलब lead में जो paint होते हैं अपने उसमें there is some amount of lead. So the paint which we use to color our house that contains some amount of lead in it. So sometimes what happens due to smell or due to ingestion of the paint, the person can develop a colicky pain with constipation, and this is called as colicky abdomen pain with constipation. This is called as dry belly ache, painter's colic or Devon's colic, which is seen in lead poisoning. Also, lead encephalopathy can occur. Treatment of lead poisoning is EDTA, that is ethylene diamine tetraacetic acid. Now we'll talk about snakes. A study of snake is called as opisthoxemia. Most common cause of death in snake poisoning is fear. Most poisonous snake in India is the common crate. Crate and cobra are neurotoxic and we see ascending paralysis in it. Also, there is a disease called as Guillain-Barré syndrome. There also we see ascending paralysis. Going further, viper is hematotoxic and sea snake are vasculotoxic. So how will you treat the snake poisoning? First, you should reassure the patient, भाई सांप काटने से कुछ नहीं हो रहा. You should do the bandage or put a tourniquet just behind where the bite is seen, and absolute immobilization. Try that while shifting him to the hospital or taking the person to the hospital. Try that the area where the bite is occurred, there is no mobilization at that place. So absolute immobilization. Incision and suction or cautery or cryotherapy is absolutely contraindicated in snake poisoning. We have a specific treatment, that is anti-snake venom, which should be given within 4 hours in case of snake poisoning, and the shelf life of that anti-snake venom is 5 years. Right? Neostigmine can also be given if there is a neurotoxicity. So anti-snake venom in India, it is produced with using cobra, common crate, and Russell viper and soft-scale viper. In चारों के venom को मिला के anti-snake venom बनता है इंडिया में. It is manufactured at Serum Institute in Pune, where we see Covaxin is being produced nowadays. Hopkins Institute in Mumbai, King's Institute in Chennai, and Central Institute of Research in Kasoli. Now, identification of snake. So first, how will you identify the snake? If you see this viper is having a triangular head. All poisonous snake heads has small scales. जो snake होते हैं उनके ऊपर scales होते हैं, lining होती है. तो जितने भी poisonous snake हैं उनके जो scales हैं वो छोटे होते हैं. Except one is cobra, जिसमें third supraorbital आंख के ऊपर के तीसरा स्केल जो है वो बड़ा होगा, लार्ज होगा. वहीं जो क्रेट है उसमें फोर्थ इंफ्रारेबियल हेड स्केल इज लार्ज. मतलब लेबियम मतलब लिप के नीचे फोर्थ जो उसका हेड होगा, स्केल होगा, वो लार्ज होगा. Now we'll talk about this creature, that is scorpion. So scorpion poisoning, scorpion bite, it is hematotoxic and neurotoxic. Treatment के लिए we usually use prazosin, right? And better option is anti-scorpion venom. जैसे snake के लिए we use anti-snake venom, वैसे scorpion के लिए we should use anti-scorpion venom, but prazosin is given usually. Atropine barbiturate can also be used, and spider bite अगर होता है, scorpion तो हो गया, अगर spider bite हो रहा है तो it is neurotoxic, and most venomous spider is the black widow spider. So these are the one-liners which have been recently asked in some of the exams. Now we'll talk about the narcotics, cannabis, cocaine, and opium. सबसे पहले cannabis की बात करते हैं, तो cannabis is also known as pot, weed, and grass. ये तो सबको पता होगा, ठीक है. So the cigarette containing the cannabis is called as joint or reefer. Burnt rope odor, जब मैंने आपको टेबल बताया था उसमें मैंने बताया था कि गांजा is having a burnt rope odor. Active form of the cannabis is THC, that is tetrahydrocannabinol. So this is the stuff which is making you high. So preparation, ganja is made from the female flower top part. Charas or hashish is the racine extract of cannabis. Charas is the most potent form of cannabis. It is having 40% of THC, that is tetrahydrocannabinol. Bhang is prepared from the dried leaves and it is used as a drink. Abhi recently Holi hua to kai logon ne piya hoga. And majoon is a sweet dish which is prepared from bhang. So ganja is the flower, female flower top part. Charas is the racine extract, which is the most, and the charas is the most potent form of cannabis, which is having 40% of THC, tetrahydrocannabinol. Bhang is prepared from the dry leaf and it is used as a drink. And majoon is sweet prepared from the bhang. Also, one thing is there that is called as marijuana, right? It is prepared from all the product of the cannabis. Cannabis is the world's most commonly used illicit drug, and the clinical features are euphoria, emotional instability, erotic feeling. Chronic addicts will have amotivational syndrome and flashback syndrome. There are few questions which have been asked, like amotivational syndrome is seen in, or there will be a history of flashback given in the patient, then what he is addicted to. So the answer will be cannabis. Run amok, that is impulse to kill someone followed by suicide. If he is killing, is having an impulse to kill someone, that is not run amok. Run amok means impulse to kill someone. किसी को मार के फिर खुद suicide कर रहा है अगर, so that is called as run amok. One more thing is there which is occurring with cannabis, that is ganja, bhang and marijuana. जो भी ये तीनों चीजें ले रहे हैं वो ये उनको किसी ना किसी को कभी ना कभी ऐसा होगा कि कोरो होगा. कोरो का मतलब होता है feeling of pain is getting smaller and smaller slowly and going inside the abdomen. So that's it. Now we'll talk about opium. Opium or afim. India में afim कहते हैं commonly, right? So it is obtained from the unripe capsule of Papaver somniferum. Ripe capsule जो होता है उसको खसखस कहते हैं या poppy seed, which is used in some states of India as in cooking. So there are two things. Ripe capsule is called as khaskhas, that is poppy seed. It is used in cooking, whereas the unripe capsule is obtained and called as opium. Opium action resembles endorphins, so happy hormone, right? So sorry, it inhibits all center except sweating, vomiting, and oculomotor. So except sweating, vomiting, and oculomotor, it will inhibit all the center. It is ideal infanticide and it is used for treatment. The treatment is done using naloxone and naltrexone. Ideal infanticide, what there was a history that in some places what they used to do to kill an infant, the lady used to come in a village, she'll take the baby and just to breastfeed the baby, she'll take the baby and to the nipple she will apply some opium and the baby will be breastfeeded and the baby will die. Cocaine. Cocaine is also known as snow, coke, white lady, or Cadillac. Cigarette containing cocaine is called as crack, whereas cigarette containing the cannabis was called as joint or reefer. Now, cigarette containing cocaine is called as crack. Cocaine is a vasoconstrictor. So, what are the clinical features seen in cocaine poisoning? Black discoloration of teeth, tongue, and gums. So, अगर कोई आपको दिख रहा है जिसका दांत, जीभ और gums सब एकदम black है, so most probably he is on cocaine, right? Painless perforation of nasal septum. If someone is snorting, you know what is snorting, right? So if someone is snorting the cocaine regularly, so he will have the perforation of the nasal septum. Also, there is special hallucination called as tactile hallucination, also known as Magnum syndrome or cocaine bugs or formication. The person on cocaine will sometimes feel that there are some bug crawling on his or her hand. That is called as tactile hallucination. For treatment of cocaine, we use amyl nitrite. Cocaine plus heroin together, they are known as speedball. So this is the plant of Erythrapsilum coca from where the cocaine is obtained. Next, we'll talk about Dhatura, also known as hyoscine, hyoscopamine, or atropine. Dhatura are three types. One is Dhatura alba, Dhatura niger, and Dhatura stramonium. Dhatura alba. Alba means white. So white Dhatura is called as Dhatura alba. Niger means black. So Dhatura niger means black Dhatura. Dhatura stramonium is thorn apple. So there are 9D seen in the Dhatura poisoning like diplopia, delirium, dilated pupil dysphagia, etc. But one thing you should remember that diarrhea is not seen in Dhatura poisoning, whereas we see constipation. Delirium is in Dhatura poisoning is known as muttering delirium. And one more thing is that is scaraphologia, picking of imaginary thread from finger or bedclothes. जैसे कोई होगा आपको ऐसे दिख रहा है कि he is just trying to pull something from his finger like this, right? Just acting. So he is on Dhatura poisoning. This is called as he is on Dhatura. He is taking Dhatura every day. So this is known as scaraphologia. It is picking of imaginary thread from finger or bedclothes. Antidote of Dhatura is physostigmine. And the medico-legal importance of Dhatura, it is a stupefying agent. So it is used for rape, robbery, and kidnapping, right? And it is also called as roadside or railway side poison because it is easily available near the railway tracks or the roadside. So this was about Dhatura. Next, we'll talk about strychinine. Strychinine is also known as nux vomica or dog button. Mechanism of action of strychinine is that it acts on the anterior horn cell of spinal cord. It inhibits the glycine formation. And fatal dose is 1 crushed seed. Remember, if there is an image of nux vomica and you have been asked what is the fatal dose, so or there is an image of nux vomica and it is asking that whether it is fatal or not, so it is not fatal unless it is crushed. So fatal dose of strychinine or nux vomica is 1 crushed seed. The clinical features are rhisis sardonicus, that is extreme grinding pace, ophistotonus, extreme backward bending. Suppose this is the body and backward bending. So this is called as ophistotonus, seen in strychinine. It is the most common posture seen. One more thing, there is amprostonus, मतलब वो इंसान ऐसे forward bend होगा. And one more is there, that is pleurotonus. It will be seen that lateral bending is there. So this kind of posture is seen in strychinine poisoning. Ophistotonus, that is extreme backward bending. Amprotonus, that is forward bending, and pleurotonus, that is lateral bending. Now there is something to distinguish between strychinine and tetanus. In strychinine, all muscles are affected at the same time. मतलब कई बार क्या होता है, this ophistotonus is also seen in tetanus. So how will you distinguish whether it is a tetanus or it is a strychinine poisoning? So in strychinine poisoning, all muscles will be affected at the same time, whereas in tetanus, first group of muscle affected is jaw. This is called as lockjaw or trismus. There is a phase of relaxation present between two convulsions in strychinine poisoning, whereas in tetanus, there is no such phase. There will be continuous convulsion. Whereas in strychinine, there is, suppose this is a phase of convulsion, this is the gap and this is the convulsion. So in दोनों convulsion के बीच में एक relaxation का time present होगा in strychinine poisoning. Now we'll talk about alcohol. Alcohol में one substance is there which is called as cogner. Cogner is a substance added in alcohol for flavor, and it is also responsible for the hangover. So cogner is a substance added in alcohol for flavor, and it is also responsible for hangover. Clinical feature of alcohol poisoning. First is frontal lobe affected. It is in sequence. First, the frontal lobe will be affected, then occipital lobe, then the cerebellum and medulla. Right. So frontal lobe, when the frontal lobe will be affected, the person will have extreme confidence with low performance. Like कई बार होता है, we see this meme, गाड़ी तेरा भाई चलाएगा. So what is that? The alcohol has reached the frontal lobe. Means the person might not be knowing how to drive, but he'll say that गाड़ी तेरा भाई चलाएगा. Why? Because he is having extreme confidence with low performance, seen in frontal lobe. For alcohol poisoning, first stage, that is frontal lobe is affected. Second is occipital lobe affected, that is visual problem. He'll see one person as a two person. Then cerebellum, there will be incoordination. And last, if the alcohol has poisoning is affecting the medulla, the patient might get into coma and death. Now, next thing which you should know about alcohol is blood alcohol concentration. So stage of excitement is seen when the blood alcohol concentration is between 50 to 150 mg%. Incoordination is seen between 150 to 200 mg%, and stage of coma is seen when the alcohol concentration, blood alcohol concentration is more than 300 mg%. BAC between 80 to 150 mg, we call that the person is under the influence of alcohol. More than 150, it is intoxicated and the person cannot perform any function. Okay? The important BAC levels. Stage of excitement is between 50 to 150 mg%. Incoordination is 150 to 200 mg%. Stage of coma when the blood alcohol concentration is more than 3 mg/%. BAC, that is blood alcohol concentration between 80 to 150, we call that the person is under the influence of alcohol. If it is more than 150, the person is called as intoxicated, and that means that person cannot perform any function safely. Then lateral gauge nystagmus is seen, which is elicited in the stage of nystagmus. That's now next is Mac-Evans sign. It is elicited in the stage of coma due to alcohol intoxication. When the person goes in coma, there is a sign called as Mac-Evans sign, which is seen in alcohol poisoning stage of coma. Alcohol mein pupil is constricted on given, due to coma the pupil is now constricted on given the painful stimulus. जब भी painful stimulus आप उसको दोगे, चिमटी काट रहे हो suppose, तो pupil will dilate, and then it will, when the stimulus is removed, चिमटी हट गई, so it will again constrict. So this is called as Mac-Evans sign, elicited in the stage of coma due to alcohol intoxication. Management of alcohol poisoning is gastric lavage. We use coma cocktail. 100 ml of 100 ml we use 50% dextrose. 100 mg we use thymine, and 2 mg we use naloxone. Okay. If no recovery is there from the above, that is the coma cocktail, we do hemodialysis. Investigation of alcohol poisoning best is gas chromatography, and it is the only legally accepted investigation. So now we'll talk about the breath analyzer. It is also called as drunkometer or alcometer. It works on Henry's principle, which says that concentration of alcohol in blood of 1 ml is same as the concentration in 2100 ml of alveolar air. यहाँ पे blood add कर देना. Okay. So this is Henry's principle for breath analyzer. Now there is an update in the drunken driving rule, which we should know. Section 185 Motor Vehicle Act, which says the permissible BAC, blood alcohol concentration for driving, is less than 30 mg%. So this was from the earlier time only. There is no update in this thing. So Section 185 is the Motor Vehicle Act, which says that BAC, blood alcohol concentration for driving any bike or car, should be BAC should be less than 30 mg. मतलब थोड़ा सा alcohol लेके गाड़ी चला सकते हो, unless it is not more than 30 mg%. How can you measure? I don't know. So what happens if you are caught while driving when you are drunk? When it is a first offense, you will get imprisonment up to 6 months, or you will have to pay a fine of 10,000 Indian currency, right? Second offense onwards, second, third, fourth, every time you will have to pay either 15,000 fine, or you will have to be under the bar, behind the bar for 2 years. So Section 185 Motor Vehicle Act, permissible BAC for driving is less than 30 mg%. It is the first offense, imprisonment up to 6 months or 10,000 fine. From second offense onwards, 2 years of imprisonment or 15,000 fine. The last topic of poisoning we are going to talk is cyanide. Cyanide is having bitter almond smell. Mechanism of action of cyanide is important. First, it inhibits cytochrome oxidase and carbonic anhydrase. CA is carbonic anhydrase. It blocks the ATP formation. It decreases the O2 carrying capacity of the blood. So these three are the mechanism of cyanide: inhibits the cytochrome oxidase and carbonic anhydrase, blocks the ATP formation, and decreases the O2 carrying capacity of the blood. On oral consumption, when we take the cyanide orally, it binds with the HCl in stomach and forms hydrocyanic acid, which is responsible for toxicity. So मतलब क्या है कि जब अगर अपन cyanide orally ले रहे हैं, तो जब वो stomach में जाता है और HCl से मिलता है, stomach में acid होता है HCl, उसके बाद वो hydrocyanic acid बनाता है जो इस cyanide toxicity के लिए responsible है. तो अगर कोई ऐसी condition है कि पेट में आपके HCl ही ना हो, तो poisoning नहीं होगी. So achlorohydria means no HCl in stomach. अगर ऐसा कुछ होता है तो there is no toxic effect of cyanide. For treatment of cyanide, drug of choice is sodium nitrite plus sodium thiosulfate. Amyl nitrate can also be given. Test for cyanide, just remember the name, Lee Jones test. Only poison for judicial execution. जितने भी अभी तक हमने poison पढ़े, जो हम forensic में पढ़ते हैं, judicial execution मतलब punishment देने के लिए पॉइजन यूज नहीं किया जाता है. ये एक अकेला पॉइजन है जो हम यूज करते हैं जुडिशियल एग्जीक्यूशन के लिए. तो ओनली पॉइजन फॉर जुडिशियल एग्जीक्यूशन इज साइनाइड एंड इट इज यूज्ड इन अ गैस चेंबर. कुछ कंट्री में एक गैस का चेंबर होता है, उसमें जो गैस है वो साइनाइड है, उसमें उस इंसान को छोड़ देते हैं और उसको इनहेल करके उसकी मौत होती है. So this is kind of a question which can be asked in exam. Now, last thing, then we'll wind up this session. That is glue sniffing. Volatile substance abuse. Most common, toluene, right? तो glue sniffing मतलब volatile substance का abuse करना. तो अलग-अलग तरीके हैं, जो भी तरीके मैं आपको बता देता हूँ एक बार, and then we'll end this session. तरीके मैं आपके फायदे के लिए नहीं बता रहा हूँ. हाँ, फायदा वो है कि इन तरीकों पे क्वेश्चंस पूछा जाता है. तो just remember that. Huffing means pouring substance in a hanky and smelling. सपोज कुछ है, जैसे अगर सपोज ये सैनिटाइजर का बॉटल है मेरे हाथ में, ठीक है, तो इसको किसी हैंडकरचीफ में लेके उसको स्मेल करना, इसको हम कहते हैं हफिंग। नेक्स्ट बैगिंग। बैगिंग मतलब सपोज एक कोई प्लास्टिक का कवर है, ये सपोज एक प्लास्टिक है मेरा हाथ, ठीक है, तो इसका जो अंदर का सरफेस है, इस पे मैंने इसको स्प्रे कर दिया, जो भी हमको वोलेटाइल सब्सटेंस का अब्यूज करना है उसको, और उस प्लास्टिक को पूरे मुंह पे से कवर कर दिया। अब जो अंदर का एरिया है जिसपे हमने स्मीयर कर दिया है उसको इनहेल करते हैं, इसको कहते हैं बैगिंग। मतलब प्लास्टिक बैग को कवर, अंदर का जो एरिया है उसमें इस स्मीयर को लगा के हेड को कवर करते हैं, उसको बैगिंग कहते हैं। स्निफिंग मतलब डायरेक्टली ओपनिंग द लिड ऑफ कंटेनर एंड स्मेलिंग, ये ऐसे निकाल के डायरेक्ट अगर कोई स्मेल कर रहा है, ये नहीं स्मेल कर सकता, इसको प्रेस करना पड़ता है, ठीक है। तो ढक्कन होता है, ढक्कन खोल के अगर कोई स्मेल कर रहा है तो उसको कहते हैं स्निफिंग। डस्टिंग मीन्स वोलेटाइल सब्सटेंस यूज्ड एज नेजल स्प्रे। कोई तो ऐसा अब्यूज करने का आदत हो जाता है, कई लोगों को वो नेजल स्प्रेज आते हैं, उसका अब्यूज उसको यूज करने की आदत हो जाती है, सो उस वोलेटाइल सब्सटेंस को वो नेजल, जैसे नेजल स्प्रे होगा उसका अब्यूज करते हैं, उसको हम कहते हैं डस्टिंग। एंड लास्ट इज ग्लाइडिंग, मतलब किसी वोलेटाइल सब्सटेंस को जिसका हम अब्यूज करते हैं उसको मैं पूरे रूम में स्प्रेड कर दूं और रूम फ्रेशनर की तरह यूज करूं, तो उसको हम कहते हैं ग्लाइडिंग, ठीक है। So thank you for watching this video. I hope it was useful session for everyone.